Hello and welcome to the Massachusetts Department of Public Health Culturally and Linguistically Appropriate Services, also known as CLAS, training series. The purpose of the CLAS training series is to provide you with the information on how to improve the quality of the services your agency or program provides to diverse members of our community. The title of this presentation is Culturally and Linguistically Appropriate Services Standards, an Overview. This is the first presentation in the CLAS training series. My name is Christine Haley Medina, and I am the Program Coordinator of the DPH CLAS Initiative. I can be reached at the address, phone number, or email listed on this page. You can also receive more information about the CLAS Initiative at our website, www.mass.gov/dph/health-equity. The purpose of today's presentation is to increase your understanding of the CLAS standards and also to prepare our DPH partners and staff as we continue to implement the CLAS standards through our contracting system for all DPH vendors holding direct service contracts. Today we will cover the CLAS standards and also talk about the DPH initiative. The CLAS standards were developed by the Federal Office of Minority Health as one initiative to help work towards the elimination of racial and ethnic health disparities. They were designed to make services more responsive to the individual needs of patients and clients, and that they should be inclusive of all cultures, but really were designed to address the specific needs of racial, ethnic, and linguistic minority population groups. The Massachusetts Department of Public Health CLAS Initiative is led by the Office of Health Equity. It is one of our administration's priorities to work towards the elimination of racial and ethnic health disparities. One way in which we are trying to do that is to integrate the CLAS standards into our service delivery systems, specifically through our direct service contracts. We will now take a moment and go through the 14 CLAS standards. I would like to take a moment to review common terms that you will hear throughout the presentation. REL means racially, ethnically, and linguistically diverse minority population. For example, my race is Black, my ethnicity is African American, and my preferred language is English. LEP refers to someone with limited English proficiency. With translation and interpretation, this is when one language is changed into another language. Translation refers to changing written documents, while interpretation refers to spoken language. The CLAS standards are divided into 3 standard categories. The first category is culturally competent care for the first 3 standards. Standards 4 through 7 are divided into the language access category, and the final group of standards refers to standards related to organizational supports for cultural competence. DPH broadly interprets the standards where it says healthcare organizations. We understand that to mean any organization that's providing public health or social services to the public. We understand the CLAS standards to fall under 6 areas for action. The 14 standards fall under these 6 categories. The first one is reflect and respect diversity. Then benchmark, plan, and evaluate. Collect and share diversity data. Build community partnerships. Foster cultural competence. And ensure language access. The first category is reflect and respect diversity, which covers standards 2 and 13. CLAS standard number 2 states that agencies should have a workforce that is reflective of the community that is being served, that staff and leadership should be representative of the service area at all levels of the organization, and that there should be written strategies on how to recruit, retain, and promote a diverse staff and leadership. CLAS standard number 13 states that agencies should have a written client conflict and grievance resolution process. The process should be culturally and linguistically sensitive, and it should be able to identify, prevent, and resolve client cross-cultural conflicts and complaints. The next area for action is fostering cultural competence, which covers standards 1 and 3. Standard number 1 is the overarching CLAS standard. It states that agencies should ensure that clients receive from all staff members care that is effective, understandable, and respectful, and also clients should receive care that is compatible with their cultural health beliefs, cultural health practices, and in their preferred language. CLAS Standard 3 states that agencies should ensure that staff receive culturally and linguistically appropriate service delivery training. It should be ongoing, and the people that receive the training should be at all levels of the organization and across all disciplines.